Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's question of the week, we have a question from the Twitter crowd. And Dr. Pane, we have a question here about abdominoplasty. Question is, what approach would you take when operating on massive weight loss patients that have had massive weight loss? I've had already an abdominoplasty with very poor results. I think my issue is that when I'm laying flat on my stomach, it looks flat, but when I'm sitting or standing, there's loose skin. So this patient's curious on maybe they should have another one, or what could they do to fix this?
That is a very interesting question. I can't give it an exact answer without seeing the person or a picture, because there's a number of things that could have happened. There was massive weight loss, so the question comes up is how much loose skin was there at the first, going into the first procedure. Sometimes people with massive weight loss have so much excess skin that a standard abdominoplasty, even if the incision goes around to the back, may not be enough to get that loose skin out, especially if it's located in the upper part of the abdomen. So sometimes those people get an extended type of procedure where they actually have a vertical scar made. And we don't do that commonly, only when it's absolutely required, or if somebody already has that scar. Getting less common these days the way other kinds of surgery are performed, more with a minimally invasive route. But if that was the case, then maybe conversion to that vertical procedure could be required here. Otherwise, it may just be that the procedure, that maybe there was a lot of swelling at the time, and as the healing took place, there's just a little extra skin left in the lower part of the abdomen. Maybe the surgeon didn't want to take that much at that time. In those cases, then the option may be just doing maybe a mini abdominoplasty and taking a little bit of additional skin. Sometimes it doesn't even require any big dissecting there. But when because there's been massive weight loss, when someone's in a sitting position, there's always going to be a little bit of laxity of that lower abdomen to some degree. Because remember, the skin got stretched out and the elastic fibers don't come back. What an abdominoplasty does is it reduces the skin, makes it seem like things are tighter. So depending on what's going on with the actual exam and what happened the first time, the recommendation could be for maybe some additional surgery with a mini procedure, maybe conversion to a bigger procedure if it looks like the first time. But those are the possibilities. More likely to do the lesser procedure from what I have seen, unless what was done the first time was really kind of unusual. So that's what I would say. In-person exam is going to be required, but those are your basic categories of what would be recommended with that kind of history. So hopefully that will cover it for you.
Well, thank you, Dr. Pane. If you have a question for the doctor, please visit our Facebook page or website or the link below. And Dr. Pane, we'll see you on the next question.
Great.